This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
We are back.
Hi, John.
Hey, listen, we took one day off, okay, for 4th of July. But we're back here live in the studio. Good morning and welcome. It's another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I am your host, John DeMasi, with the one and only Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We discuss on this program the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you and your family potentially improve your quality of life. That's our mission statement, and we are here ready to talk to you. The number in the studio, 855-839-1210. At any time during the course of the show, you have a question or you have a medical challenge you want to run by Dr. Molly, that's what you do. You pick up the phone and call 855-839-1210, and we trust that, Dr. Molly, you enjoyed your 4th.
I did, John. And, you know, I want to just say one thing. I want to give out a word of advice before we start during this heat wave. Hydration, folks. Do not underestimate hydration during this time, right? This is critical. These temperatures can really knock us for a loop.
And of course, sunscreen as well.
Oh, my goodness. You know that. You know that. Then,
you told me before the show. Are you using sunscreen?
Yeah, you're right. You're right, John. Thank you.
So let's talk about Innovative Medical Associates.
Sure.
How it's different and why it's different.
Sure.
What exactly do you do?
John, that's an age-old question, and you know it comes up all the time, and God bless you when you're there on your Tuesdays and Thursdays, they're asking you the same question.
That's
exactly
right.
Doesn't matter how often we talk about it. As you know, I have a licensed primary care facility, which means that our physicians, our healthcare providers, can do anything that you would normally do with your GP. So if you need medication, it can be prescribed. If you need certain laboratory tests, we actually have the blood work we can send out right from the office. If you need radiology, you can go. We refer you out to the radiology. But what makes us really different is our approach to your particular challenges. We believe that if we can help you arrest your challenge, improve your quality of life, by helpfully reducing the amount of medication that you're on, by substituting some natural substances, that is a better way to improve quality of life. Because you and I both know, look at how many side effects there are for all these medications. And the newer the medications, the longer the list is.
Oh, absolutely.
It's unbelievable.
Absolutely.
And so in doing that, our philosophy is let's do this with vitamins, minerals, amino acids, natural substances, God's ingredients, which, you know, I'm a firm believer in. And have we had success with that? Absolutely. We certainly have been able to help people manage their situation and improve their quality of life by utilizing the natural substances. I think the biggest challenge with that is making sure that the nutraceuticals get to the therapeutic level. And you know how we do that.
Absolutely.
With
Through
hydration.
That's right.
And I'm glad we echoed that.
What has been your biggest challenge?
Well, I think lately I've seen more and more cancer supportive people. As you know, you're there. But I would say the autoimmune situation is also high. And that's more difficult and more delicate. And I would say post-viral infections since COVID, John, even though it's a long time ago when you think about it, right?
Yeah.
It's called COVID-19 for a reason,
yes,
right?
It happened a long time ago. Yeah.
Right. But people are still suffering from the effects of the COVID, and it's coming out in sort of obscure ways. So, indeed, we find that people tend to do better. So I have a whole gamut of people. I have people with autoimmune disorders like MS and ALS, and also things like Parkinson's. In fact, I'm seeing a rise in the Parkinson's patients. So, and there are things you can utilizing the hydration protocols, even with subclinical doses or repurposed medications. That's another interesting thing. We can repurpose a medication for a particular challenge, possibly in a much lower dose, and effectuate the change for the patient.
Do you find that the challenges come in droves? Or,
sure.
I mean, now you've got a whole run, and we're going to talk about POTS later on.
Right.
But you've got a run on that.
Sure. Yeah.
What do you do about that?
Well, I think, there's really, the thing is, I think people, as they're becoming more educated about autoimmune and what else can be done through your cancer journey, I think places like mine, and certainly us in particular, because I believe we're on the forefront of the cancer supportive, they realize there are other things they can do to help them through their journey and really improve the quality of life, because you and I both know the cancer journey is rough enough. Utilizing natural substances to augment seems that it's a perfect fit for that kind of thing. The idea is you want to use the right things that don't interfere with the conventional treatment, whether that's radiation or chemo or some variation of any of that.
We have been conditioned to believe that pharmaceuticals are the answer to everything.
Yeah, it's the panacea, right? Yeah.
How do you navigate that challenge?
Look, John, I have a PH.D. in molecular biology and biochemistry, so I am certainly not against bio substances, right? I'm not against that. I'm not against pharmaceuticals. What I say is that, and I think this is prudent, you want to use them correctly. I think part of the problem, and many times the drug itself has gotten a bad rap, honestly. It's how people use them, how they've been abused, and also the overuse of some. There it is.
Yes.
That's the key. I mean, if people look, our age. We don't have to tell the whole audience, right? But we're
Yes.
seasoned, right?
Yes.
We're seasoned. You don't get out of this life without possibly taking an antibiotic or an antihypertensive med, something like that. The idea is, though, to utilize the least amount we need to effectuate the change so that the body, A, doesn't become conditioned to taking more and more and more, and B, that our quality of life doesn't suffer. And I think in that regard, certainly our practice, our facility is doing its job.
It goes without saying that we are over-medicated.
Oh, no doubt about
There's
it.
no question about that.
No doubt about it.
So how do you navigate that?
Well, you mean, how do we help a patient reduce their need for
Yes.
the med? Well, that's something that Dr. Kaska and both of my physicians are acutely involved in. Obviously, we have a meeting every day in one way or another. Even when Dr. Kaska isn't there, we're on the phone. We're on the phone, we Zoom in, we do our meeting, we go over cases, and we then try to help a patient. My registered nurses, what do? They help a patient reduce their need for the medication, and then I slip in and give them what I think will augment their condition and help their quality of life.
Does this work, the hydration?
There it is again, John. Does it work? Well, come on in. Come on in, talk to my...
It works for me.
Listen, I say to my people who come by the office, look, don't go by me. Come on down to the office, talk to the patients. There is no way a placebo effect can absolutely just hang out in my facility, right? It doesn't work like that. We have thinking patients, do we not? We have thinking people,
yes.
Entrepreneurial, high-level executives. These are the people who really, really get this. I have a few physicians, as you know. I have physicians who come to us.
Yes.
You know that.
Yeah.
This week I was saying doctor this, doctor that, and now they don't make it a big deal to say that they're there to their patients, but they're smart guys. They're augmenting what the traditional treatment is because they had some side effects, and they want to reduce that.
They are interesting patients and interesting people because
Right.
I've had discussions with them. And, we talk about all kinds of
Of
things.
course.
And it's very interesting,
Of course.
And they are thinking people.
Absolutely. And that's really the difference between what we do and many other practices. Look, John, we're not a spa. You're not going to come in here and we're going to give you Botox injections, or we're not going to give you a facial. This isn't what we do. Okay, what we do is true medical hydration, and I believe that's the difference. Just look at how our facility is equipped. That'll tell you. Bottom line.
Yes, and we're going to talk about later on in the show.
Oh yeah, more.
Equipment
Sure.
And I'll tell you. But the answer to the question, how long does it take for to effectuate change?
Listen, John, that's a loaded question, because if you come into me and you're stage 4 cancer, well, it's going to take me a little while to build up your reserve. So don't expect to, walk on water in 1 or 2 treatments. And I think that's true across the board. Lots of folks, if they come in early enough with their particular condition, I'll tell you, I myself am impressed with how many people have come into me with depression. I've seen a lot of that in the last year. And we're able to help them through that depression, reduce some of the antidepressants, not throw them away. Look, you'll never hear Dr. Molly say, throw away your meds. No, never, none. But help augment them in a way that they're utilized better in the brain. Therefore, they can maintain their dosage in a little bit lower rather than to keep, upping the dose.
So you try to reduce.
We do. That is the bottom line. And if we can, for example, we've gotten plenty of people off their cholesterol meds. That is absolutely true. We've been able to do that, maintain, obviously with some help from the patient. Look, John, you can't leave my place and eat 4 slices of banana cream pie, right? And expect that your blood sugar is going to be okay, right? I mean, that's the other thing. I have patients who come in and say, well, see, Dr. Molly, yesterday I just had 2 pieces of key lime pie, and then later my daughter-in-law made this fabulous peach part. I said, no, guy. She goes, why do you think my blood sugar is 350 this morning? Well, that's why. Yeah. But, look, we really have to be smart. We have to look at your nutrition. We have to look at what you're taking orally. All of these things go hand in hand. So the earlier you get in, the better off you are.
Yes. And so the goal is to reduce the medication.
Right. And improve life.
Improve life. And the nutraceuticals
help that. They aid that. They can
not
replace. Not
necessarily replace, but
they can assist.
Yes.
They can assist. And I would tell you that I think we, meaning my entire healthcare team, we have become experts in doing that, because our concentration has not been on being spa-like. It has been on doing nothing but looking at the medical and the science of what we do.
And with that, we are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210. That's our number here in the studio. If you have a question or a medical challenge you want to run by Dr. Molly, now's the time to call. We always tell you, call early because you don't want to get shut out. 855-839-1210. That's the number. We're coming back. More of today's edition of Health Watch after these words.
Cancer, a scary word, but not so scary if you have the right team. Hi, this is John DeMasi, host of Health Watch, Sundays at 8 and again at 4 here on Talk Radio 1210 WPHT. And that team is Dr. Molly Fantasia and the medical staff at Innovative Medical Associates. Yes, cancer is a scary word and a difficult condition if you've been diagnosed. Over the years, the staff at Innovative Medical Associates has helped hundreds of patients with their unique medical hydration protocols. Cancer support is a large part of the practice at Innovative Medical Associates.
We believe in medical hydration. We've improved it so much that we are able to help people across the board with challenges before they become chronic.
Talk about improving your quality of life. Most likely, that'll happen when you visit Innovative Medical Associates. Check them out on the web at innovativemedicalassociates.com or call 856-489-0505 to schedule your initial complimentary consultation.
We are back here on Health Watch, and as always, operators standing by right now at Innovative Medical Associates. 856-489-0505. That's the number. And why do I give that out? Well, because if you want to really sit down with Dr. Molly and get the initial consultation, which is complimentary. What you do is you call that number right now and set up the appointment. And it's very simple. As I said, it's complimentary. 856-489-0505. That's the number. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on that as well. The program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And again, our number here in the studio, 855-839-1210. 855-839-1210. Okay, Dr. Molly, I'm going to have you tell us what POTS stands for.
POTS, yes,
because
POTS.
It's a long...
But you know what? Here's the thing. It's not what you have in the kitchen, folks, okay?
No.
It's postural orthostatic tachycardic syndrome.
Okay, I'm glad you said that.
Yeah, that's that, and it's the way I said it, I'm sure is Philadelphian, but that's okay. South Philly, maybe, okay? Yeah. But it's very complex and misunderstood kind of syndrome. In fact, it's a form of dysautonomia. Now, you're going to say, what the heck is autonomia? Autonomia is what goes on in the automatic pathways of our body, and we don't think about autonomia because it works on things like our breath. It keeps us breathing. It keeps our blood pressure and blood volume up. It makes a difference in whether we have lightheadedness. Hence the thing. The P, of course, the condition related to the posture of the body. The orthostatic involves the position of the body, okay, the sudden drop of blood flow and dizziness. The tachycardia, of course, refers to what? Heart rate, over 100 beats a minute. And the syndrome is not necessarily a disease that they say, but rather a group of symptoms that are often grouped together. And that is what POTS stands for. So I guess in a clinic like ours, my healthcare providers and myself, we look for a functional way to help these people because you can see it affects lots of different systems, right? The autonomic system is very important because if you can't breathe, you're not going to live, right? So it also affects GI tract. It can affect the kidneys. It can affect many various systems, including the adrenal system. So when we look at this, when a patient comes in with a group of these symptoms, the bona fide way, the only way that they were able to really say that someone had POTS was to do something called a tilt test, which is generally done in a cardiology office or whatever. But it's necessary to do some other testing, whether we test for the adrenal function, and we do that at our place. We test for the thyroid function and see if it's, firing correctly. We test for blood sugar, electrolyte balance, and we also look at the GI tract, okay, testing for micronutrient deficiencies, cardiac abnormalities. Even with a simple EKG, we're looking for some of these things. So there are many other traditional testing that you need to put together for a POTS patient before you would send them off to a specialist, so to speak.
You said that earlier it was hard to diagnose.
Very hard.
I could see where that's the case, but if a patient has this,
yes,
how do they know?
They don't know. What happens is they just know overall they're feeling lousy.
Okay.
Right? They're feeling lousy. They have metabolic problems. They have digestive problems. I'm going to go to one of my patients that okay. She came to me. She's a young girl, 33 years old. She's a librarian, okay? Julie is her name. Julie is an absolute real indicator of someone who has POTS and has probably been misdiagnosed for the last 5 or 6 years. She has gone to so many specialists, but not one person has been able to help her. So she's back in my chair, okay? She left me for this period of time. I am telling you, she has 32 separate visits of all types of physicians. And when I looked at her, and when I looked at this from a functional medicine point of view, and when I sat down with my 2 physicians and I said, this kid has a challenge in her autonomic nerve system. And they said, Molly, you're probably right. The idea is, how are we going to help her? Because she's on so many medications. How do I help someone like that get off one step at a time. So when you ask me how long is this going to take, I told her already, don't look at a complete reversal until January. That's telling you, right? That is a fact. That's a fact. Yeah. I mean, she's taking, I think, 17 different types of medication, and she's gone to over 30 different practitioners. So POTS is complicated.
Yeah. So what do you do about this? I mean, you said it's going to take until January.
First thing I got to do, and I've done it, is comprehensive metabolic panels, comprehensive neurotransmitter panels, adrenal functions, vitamin D levels. I have to look at what's going on in the motility of her gut. I mean, these are the things that have to be done. All of this takes time. But how do I treat it? With hydration. Believe it or not, POTS responds to hydration. It is the one thing universally. Now, people who have POTS, even after they're diagnosed traditionally, have to go in for hydration. But they're only getting what? The salt water. What we do is beyond that, because I want to bring back a lot of their functionality.
And what do you use to bring back that?
Well,
just give us an overview of that.
Well, one of the things I would use is vitamin C. Okay, vitamin C. I would use certain other antioxidants. I would use anti-inflammatories. These are all in the bags from our perspective of what we do for POTS patients. We might use a subclinical dose of things that relate to the adrenals. We are definitely looking at subclinical doses of LDN, low-dose naltrexone. Lots of data to support using it. But again, the most important thing is the hydration, the electrolytes. Definitely, we'd use things like sodium, magnesium, potassium in the bag. So there are many things that have to go into this, but this is not done helter-skelter. You have to take one step at a time, because why? Go back to how many systems are involved. It's not just one system.
It's many systems.
It's multitude.
Obviously.
Again, we got to look at all of these, right? But the bottom line is, this is a complicated case. You need to get back on your feet without dizziness, for one thing. And guess what? You've got to start looking at this as a full syndrome. And this is going to affect the way you live, maybe for the rest of your life. So the idea is, let's get into a plan of action so that we attack this, and little by little we reduce your symptoms and get you back on your feet.
After the diagnosis, you were telling me that you send them to the cardiologist.
Many times, because he happens to be in South Jersey. He happens to be the one guy who's specializing in POTS in particular for the cardiac issues.
So that's why you send them to that particular cardiologist.
Right, exactly.
And then where do they go from there?
Well, hopefully they come back to my chair, which they're going to need. And actually, he'll send them back, because he said you're going to need hydration on an ongoing level. See this weather right now?
Yes.
The POTS patients are miserable. I mean, we're miserable ourselves, and we don't have it,
Yes,
right? So imagine having POTS and having all that syndrome. So definitely, you've got to look for a place like ours. And I will tell you, yeah, you can go into a spa, but you're not going to get a focus type bag, and therein lies the difference.
You have more cases than usual with
lately.
POTS.
Yes.
What do you attribute that to?
I'm attributing it to viruses, because lots of these people have exposures to Epstein-Barr virus. They have exposures to mono. But I'm also seeing something, John, post-COVID. I think there are many more people who have mostly symptoms of POTS. If they don't have the whole POTS syndrome, they have many of the symptoms that POTS really that are attributed to POTS. So I see that from the post-COVID. And, people are talking still about the fatigue from the post-COVID. This is another thing about POTS, highly fatigued.
So you're attributing that to COVID?
Yes,
Okay.
COVID and viruses, period. It's a real mess. It's a real mess. And how many people have Epstein-Barr? How many people have CMV? How many people have mono? The exposure itself can start this. Interesting. An exposure to the viruses and then added stress. Can you imagine the stress you have having POTS? You're out of your mind,
yeah.
Right? So what do you think that does? That revs up your entire sympathetic and parasympathetic system. So it's going to be dysregulated.
We are coming up on the halfway point of the show. It's Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. We have some open lines, so if you want to get in, now's a good time. 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We are coming back. Both of us return with more Health Watch after these words. We are back here on Health Watch. Again, operators standing by at Innovative Medical Associates. 856-489-0505. That's the number. 856-489-0505. When you call, you want to set up that initial consultation with Dr. Molly. It is complimentary, and you can really learn a lot about not only Innovative Medical, but your condition, and etc. So check it out. Make that appointment, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio, 855-839-1210. We're going to continue, Dr. Molly, with the discussion of POTS. And
yeah, that's great.
Yeah.
So, John, you know, and this week I have started to use something with AI, artificial intelligence.
Yes.
This is a computerized test that we're doing in our facility. And I'm actually running this. And initially I was a little skeptical about this instrument. I was skeptical. I'm still the scientist. I was skeptical. And I went out and I met the manufacturer. I was out in Florida. Well, by the way, when the heat was 90 degrees in Florida, I went out there. I saw this, and I said, listen, I really like this protocol. I would like to use it in my clinic. And, of course, I went out. I got the instrument. I'm using it. And believe it or not, I'm equating what we're getting on the instrument. And the instrument is a very simple thing. We put leads on your body. It's 7 minutes. You actually had the test, right?
Like an EKG.
It was like an EKG, but there were more, right?
Yes.
We had it on your forehead.
Yeah.
We had it on your arms. We had it down on your feet. Remember that?
Yes.
We did it on your feet.
Yes.
Okay. So, and there is a system. It runs a particular protocol. You run through the protocol. So I really like this for my POTS patients because this is another tool to support someone who's saying they have all these symptoms and the conventional GP or whatever said to them, yeah, it's in your head. Right? This is another tool.
They've all said that before.
Right. This is another tool. You put this together with the bona fide blood work that is traditional. This is a little non-traditional, with maybe a traditional EKG and some other types of testing. You put that package together. It's hard to say somebody doesn't have a POTS syndrome or a POTS-like syndrome. So let's talk about what we were measuring, all right? So one of the things we were measuring was the autonomic nervous system markers, okay, sympathetic nervous system. And again, you remember me talking about autonomic. It's the stuff that goes on automatically, like our breathing, like blood volume, these kinds of things that we don't think of. And thank God we don't have to think of them every minute,
right?
Because then we couldn't function at all, right? So the bottom line is this test did several things in this list. So it had a response to sitting and standing, if you remember, sitting and standing, and we had the leads on you, and we got readings. Then we looked at the parasympathetic nerve system, right? At your respiration and your inhalation. Do you remember breathing in, John,
yes,
as well? Okay. Then it really looked at interaction from the heart rate. We made you stand up, if you remember, and the leads were still on. And again, it's all running into the computer, and the AI doc is looking at that and compressing this information for myself and my docs. Then we looked at something called galvanic skin response, which means how the skin reacted to certain stressful situations. And we did that also. So again, this was done when you were standing, sitting, moving your arms up, down, that kind of thing. So what happened is we checked your conductivity. We looked at your microcirculation. We look at oxidative stress. We have a marker for that. And the interesting thing is, we looked at the adjusted upper conductivity going to your thyroid, which is in your neck, and ultimately your digestive system. So have I just hit everything that POTS says is dysregulated?
Yes.
Yes. So then it's all put together. This data is all put together, compressed, and I have a roadmap or a bar map for microcirculation and oxidative stress, cardiac autonomic neuropathy risk I'm able to look at, and we can get a score for these things. And in that score, we can see whether you really fit a full-blown POTS syndrome or a partial. And believe it or not, John, partial is bad too, right? I mean, you may not have all the symptoms, but you still have POTS. We're also looking at vascular function. We did blood pressures, stroke volume, right? Blood pumped and beat, right? Cardiac output, which, by the way, was done many, many times with an echo. You've had that.
Yes.
Right?
Yes.
That would be something that we would probably send a patient out for when we were doing this before we had this test, an echo. So then we're looking at endothelial stress, which means at the skin level, at the endothelial. And so we're looking at C-reactive protein, immunofunctions. We look at what augmentation, and we can get a reading whether you're normal, borderline, or abnormal. And believe it or not, when we've looked at this, we're able to look and compare what your vascular age is to your true age. So, for example, my POTS patient is 45, but they had a vascular age, which meant the microcirculation age of 65. That's significant.
Wow.
And this is a significant thing. I'm telling you, I'm very excited about this test. So then what the body K does, which means the body knows, that's the whole point of the K, the body knows. The body then tells us what our wellness risk is, what our autonomic system comments are. It tells me that the cardio autonomic test results were abnormal, and here's the areas to concentrate on. Now, what does that do for a clinician like me? It tells me, Molly, you might have to change the B vitamins in that bag. You might have to change the coenzyme Q10. They need more of it. Do you see what I'm saying?
Yes,
it's how we
really,
use this test.
It's comprehensive, yes.
It's comprehensive. And then ultimately, we're going to have a status report. And what am I going to do? Well, Dr. Molly's taking this information, and that's going to become your baseline. And after we get a quasi-diagnosis, and that's all it really is, I mean, it's a judgment diagnosis that you have POTS or some other type of, let's say, autoimmune disease, right? I'm taking this, and then I'm putting together a protocol for you that includes the nutritional things like B vitamins and particular types of B. You hear me talk about this all the time, methylated Bs, hydro Bs, not just cyanocobalamin. Then I'm going to look at folic acid, not just folate acid, not folic acid. I'm going to look at certain things like coenzyme Q10 in certain amounts for a patient who I see has certain abnormal results on this kind of test, plus put together the blood test traditionally that we send out. And now I have a whole profile on that patient. And can I then customize their drip? You bet. You bet.
Can you use this, and this is called the body K,
yes,
or the body knows.
Yeah.
Can you use this for other areas?
Yes, I'm doing it. I'm doing this for even my well patients, because what we're able to do is look at a lifestyle score and say, you think you're doing all this exercise, you think you're running 10 miles a day. Well, let me show you how the body's responding to this run. And it shows that maybe he needs more, let's say, preventative type workout before he runs. It's not just the running. You follow me?
Yes.
So there are so many things that can be done with this. Using this I'm really looking forward to using this with a physical therapist and saying, look at this in terms of people who think they're perfect, right? Yeah. And we have the data to show you're not so good, you know?
That's right.
And the digestive issues, that's another thing. Very interesting. When I saw the test and it picked up what's going on in the gut, What did that do? It helped me change up particular drips in addition for the probiotics. And right now, I have several people that have Crohn's disease and this kind of thing. And I'm working on a young man right now.
Yes.
So I ran this test on him, and I'll be darned if that didn't come up right on the AI, showing that he had it.
Really, this is a way for you to improve
That's what I'm
you've
doing.
already done.
Exactly. What I love about this is a good use, folks, of AI. I am so tired of hearing how everybody's afraid of artificial intelligence, right?
Yes.
You hear, it's going to rule our life. Well, it has some good things, too. I mean, I don't want it to become Big Brother. I don't want it to take the place of my fine medical directors. But as a tool, I think it is unbelievable because it's unbiased. Do you know how many people come in with all of these kinds of symptoms that I talked about earlier, and other physicians and healthcare providers say it's all in their head?
Oh,
this test,
you get that every day.
Every day. This test can show that it's not in their head. They're not crazy. They definitely have something going on in systems that we overlook, the autonomic system that we overlook and take for granted. The beauty of the body is God's given us all of these things, right? I'm a believer, John.
Oh yeah.
He's the big physician. He's given this. Now I have a way to measure the gifts he's given.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge that you want to run by Dr. Molly. 855-839-1210. That's our number here in the studio, 855-839-1210. Our program is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are both, Dr. Molly and I, coming back with more of today's Health Watch after these words. We are back here on Health Watch. Again, operators are standing by right now at Innovative Medical, and they will be there well after we leave you at 9 o'clock. So they're not going to the beach today. They're standing by. All right, 856-489-0505, 856-489-0505. That's the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, or if you want to hear it again, we have our Health Watch replay every Sunday, 4 until 5, right here on Talk Radio 1210 WPHT. Our program is Health Watch. We are going to the phones right now. We're going to talk to Dan in Haddon Township. Dan, good morning. You're on with Dr. Molly.
Hey, Dan. Go.
Hello, Dr. Molly.
How are you?
All right.
Good.
I'd like to know if your office has experience with hydration with Laetrile or amygdalin.
Well, I can't answer that. And you know that they're technically, Laetrile and amygdalin are not really readily available in the United States, as you know. And if you call my office, I would love to get into a discussion with you. Okay?
Okay,
that's all I can say. Thank
Okay.
you. Bye-bye.
All right, thanks for the call, Dan.
That's a very interesting question because that goes to cancer supportive care. And again, Laetrile and amygdalin are really products that are not sanctioned by the FDA in this country to use. So, I would like to say that, we have to be careful about our products. That's what I'm saying. Okay. Thank you.
855-839-1210. That's our number here in the studio. We want to talk about one of your patients, Joe.
Yeah. So Joe comes in from Indiana or Ohio. Joe's comes in from Indiana and Ohio. And what's going on is that he came to me with very, very severe GI issues, Crohn's, and he is a mess, absolutely a mess. So he's been treating with a GI doc in Ohio, and the doc wanted to put him on a biologics. The new biologics are out. But, there's a lot of side effects with the biologics, including depression of your good cells, right? They have depressed your immune system. And apparently the doc out there thought that's the only way for him to be able to control what's happening with the severe diarrhea. And anybody out there who has Crohn's or these types of conditions knows they're terrible. I mean, they really wreak havoc with your life. By the way, he's bone thin, so he's not getting any nutrition because he's just passing it right out. So he started with me last week, and he already has seen improvement just in doing some nutritional therapies with him and not really addressing the Crohn's disease in the moment because I was waiting back for some of the blood work, etc. So I can tell you that we are treating this very uniquely because it turned out that the biologic was $30,000 for a month. And he said he simply couldn't afford it and he wasn't going to go down that route. So I came up with an alternative route using subclinical dose of a particular medication and also a certain type of implant that is out there, but I can't discuss that on the radio per se because I'm not a spokesperson for the group for the particular pharmaceutical company that puts it out. But anyway, it's more natural. I can tell you that. Anyway, the bottom line is he called me on Friday. I didn't go into the office because Friday's the day I start doing all my protocols for the following week, and he called and said, "Hey, Dr. Molly, I'm feeling so much better." I said, "Really?" He said, "I already see a change in my stools." And of course, my nurse administrator said, "Molly, he looks like a different guy." I said, "So he's feeling more robust." To me, that's a win. I don't think we could ever cure the Crohn's entirely, but we also gave him new nutrition. We improved his vitamin D, his vitamin C levels, his B levels were completely down the drain. The other thing was amino acids. Why? I have to build up his muscle mass. He looks like a skinny olive oil type. I mean, that'll tell you the truth. I mean, that is a mess. And, of course, CoQ10 for his cardiac function. So, again, this is the way we approach this. It's a two-fold thing. We've got to improve the micronutrition, which then improves our autonomic nerve system, etc., which actually runs how quickly we actually move waste through our GI tract.
You know, I'm wondering, is it his diet, his nutrition?
Well, certainly his nutrition had to be looked at. We had to look at, seeing if he was allergic or celiac, that kind of thing. But frankly, I think it was a little more than that. He actually had an exposure to C. diff. And C. diff, as everybody knows, can be a hospital-acquired infection that is very difficult to eradicate. Lots of people got C. diff through COVID, lots of them, and didn't even know they had it till much later. And he was one of those patients. So as a result, his entire GI tract in terms of his flora has been messed up since day one, which was several years ago.
And you wanted to talk about another patient.
Oh, Sandy M. Sandy M is a patient that I had who I actually sent to the cardiologist to really get a bona fide diagnosis of POTS. She comes in twice a week, she's coming in twice a week, and she's getting high dose nutrition as well as hydration. When I'm talking about high dose, I'm talking about at least 1,000 or 2,000 mLs of fluid, along with electrolytes, etc. So she's a 3-hour drip, 3 to 4 hour drip in my office. And she tends to be doing better, but of course she has her rough spots because, again, this POTS takes on a life of its own because it can affect our GI tract, it can affect our cardiac, it can affect our blood volume. So weather like this, she's going to be much worse. And I'm expecting her to come in this week a little bit under the weather.
How long will she have?
She's a lifer. She's a lifer.
So she's got to go.
She knows it too, and she knows it. And indeed, she's also on certain medications, but very small doses because the doc himself isn't a big believer in putting them on too many medications for the POTS, just enough to help the systems regulate more naturally.
So she knows that she's got to be there.
Yes. And
what, once or twice a week?
Yes. And I have good news. One of my patients from Indiana went home. The one that had the lung problems and the Q fever, which was a particular bacteria that is very unique to the Ohio Valley. Wasn't seen here in this area. But she went home on Saturday morning. I got a beautiful note from her family. They're welcoming her home. She's feeling pretty good. We're following up in 3 months, and I think that's a success story from the perspective of in terms of the lung problems.
It's another success
story.
You've had a lot of them.
Well, yeah, but I mean, this one was really touch and go. I'll tell you that. She was worrisome to me.
There's a lot of touch and goes.
You see them, right? The idea is I thank the good Lord upstairs because he's the he's the big doctor as far as I'm concerned. Okay.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by, and they'll be there well after we leave you at 9 o'clock. 856-489-0505, 856-489-0505. And check out the website. A lot of good information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And don't forget, we're on again this afternoon, 4 to 5, a replay of this morning's show, 4 until 5 this afternoon, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, and Daniel, and of course there's Joanne, delightful Dee, fabulous Fran, and our medical assistant Sandra. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday, 8 till 9, Health Watch here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.